Welcome, and thank you for standing by. All participants will be able to listen only until the question and answer portion of today's conference. To ask a question, please press star 1. Today's conference is being recorded. If you have any objections, please disconnect at this time. I would now like to turn your conference over to with Ms. Karen Francis. Miss, you may begin.
Thank you, and good afternoon, everyone, and welcome to the second webinar for the 2017 Rural Behavioral Health Webinar Series. Again, my name is Karen Francis, and I'm a principal researcher at the American Institutes for Research and lead for the Rural Behavioral Health Initiative, along with my colleagues Joyce Sabian and Laura Fleetwood from the Mental Health Promotion Branch at SAMHSA. This webinar series is supported by the Mental Health and Promotion Branch of SAMHSA in collaboration with the American Institutes for Research and Affirma Solutions. We're also pleased to have in the room with us today Ingrid Donato, who is the Chief of the Mental Health and Promotion Branch here at SAMHSA. So, Ingrid, thank you so much for joining us.
Thank you, Dr. Francis. The Mental Health Promotion Branch is thrilled to be able to support this important webinar series. Addressing the behavioral health in our rural populations is incredibly important to the mission of the branch and the work of SAMHSA in general, and your expertise and leadership of this has been extraordinary. Thank you.
Well, thank you so much. So again, thank you for joining us this afternoon for this webinar entitled Providing Culturally Competent Behavioral Health Services to Diverse Populations in Rural Communities. Now, our webinar today will take a slightly different format from the other webinars that we've done in the past. Today our webinar will be in the format of a live interview with LaRae Parker, who is the Cultural and Linguistic Competence Coordinator for Madison Cares in Rexburg, Iowa. Today I will talk with LaRae about her work in Rexburg, Iowa, and learn more about strategies of her rural community in providing culturally and linguistically competent services for children, youth, and families from diverse backgrounds. And we'll also talk a little bit about some of the strategies that are being used to integrate cultural and linguistic competence into the delivery of these behavioral health services. We will invite you to ask questions of the presenter at the end of the webinar. You can ask questions to our presenters by either typing your question into the participant chat box that is located on the right-hand side of your computer screen. We will try to respond to as many questions as time permits today. Please also note that this webinar, both the PowerPoints as well as the audio of the webinar, will be posted on the Rural Behavioral Health portal in about 1 week from now. And at the end of the webinar, I will provide you with the link for the Rural Behavioral Health web portal. Just a reminder to everyone, we ask that you mute your phones during the presentation so as to avoid any background noise as the presentation is given. Also, please do not put your phone on hold, as we may be able to hear any background music or messages that are recorded on your phone system. So without further delay, let us get started with a few polling questions. We want to learn about the participants joining us today for the call and where in the country you're located. So our first polling question today is, in what region of the U.S. is your community located? Please take a few minutes to respond. To give you just another half a minute or so. All right. And so I see that many of you are joining us today from the Northeast and Mid-Atlantic regions of the country, as well as from the Southwest. And we have a number of our participants on the call today from the Midwest. So again, welcome. So to our second polling question, what is your role in your program or your community? management or administration? Are you a clinician and provide services? Family or youth? Community-based provider? Federal, state, or local policymaker? Do you represent a faith-based advocacy or community coalition? Are you a consumer, or do you play another role in your communities? Again, we'll just take a minute or so to get those responses. Okay, and I see here we have a number of our participants today who are management and administration, who are clinicians or service providers, and community-based providers. Thank you. And then our final polling question is, how would you describe the cultural diversity of the rural? How would you describe the cultural diversity of the population in your rural community? Do you see it as very diverse, moderate diversity, minimal diversity, growing diversity, not diverse at all, or you don't know? And this polling question will just give a few minutes here also. And just let me say thank you for taking the time to respond to these polling questions. And so we see that many of our participants today have said they either have minimal diversity or growing diversity in the communities, and there were a number that also said they don't know what the diversity in their communities look like. So, I think that this is a good launching point for, this webinar this afternoon. And so before I, turn the interview with LaRae, I'd just like to just set the stage about, what is it that we're going to be talking about this afternoon. We titled this webinar, as I said, as Providing Culturally Competent Behavioral Health Services to Diverse Populations in Rural Communities. So what do we mean when we say cultural competence? As you can see here on the slide, we refer to cultural competence as a set of congruent behaviors, attitudes, and policies that come together not only in organizations, but among the professionals within those organizations or those communities that, intended to foster or improve effectiveness around cross-cultural situations, the delivery of services and support, the engagement with diverse communities. And, just consider cultural competence like fluency. In other words, when you are fluent, you are able to navigate and operate within that culture with a level of ease and understanding. And it does take some time to get to the point of cultural competence. We often in the field call it a journey, that, it's a constant learning process. It is a constant process of continual engagement and collaboration and partnerships, and quite often sometimes making mistakes, learning from the mistakes, engaging stakeholders in conversations to learn, to gain cultural knowledge and cultural fluency. So as we talk about cultural competence, and then we move to talk about this thing of linguistic competence. And this is where we focus on the capacity around language, whether it be from an organizational level or a personal level, how we communicate effectively to convey information in a manner that is easily understood by diverse audiences. And these diverse audiences include individuals who are limited in English proficiency, who may have low literacy levels, who or not literate at all, or individuals that are with disabilities. It is about how we are communicating, whether it be in the spoken word, the written word, or the nonverbal communication patterns, but ensuring that we are able to communicate in a manner that is effective and meets the needs of the individuals that we are serving. So why focus on this issue of cultural competence? And you know, when we talk with LaRae, you know, in a few minutes, you know, it will come to light more clearly why it is so important for us as, you know, as we go about providing behavioral health services in communities across the country, that the cultural competence is important. We focus on cultural competence to eliminate disparities and disproportionality, to help us implement strategies that acknowledge and respond to the history of trauma that many of the individuals in our communities face or have faced. We focus on cultural competence as a guide to help us in the development of promising practices or evidence-based practices, as well as community-defined evidence, you know, that will be able to meet the needs of specific diverse populations. And we focus on cultural competence to effectively address the behavioral health needs of all children, youth, and families. And this is where we often talk about this issue of the 5 A's. Our focus on cultural competence helps us to develop program and service outreach and engagement with diverse communities to maximize access to these services, availability of these services, affordability, appropriateness of these services, and also acceptability of services. So having said all that, what does cultural and linguistic competence look like in practice, right? And so I am really pleased to have LaRae Parker, as I said, Cultural and Linguistic Competence Coordinator for Madison Cares in Rexburg, Iowa. Good afternoon, LaRae, and thank you for agreeing to do this interview with me today.
Hello,
and I'd like
I'm glad to be here.
Thank you so much. Just want to ask you a few questions about your community and, you know, really about the wonderful work that you're doing in Idaho. So, LaRae, Madison County received a Systems of Care grant in 2009, right? And
yes.
then a Systems of Care expansion grant in 2015, right?
Yes.
So could you, you know, how would you describe your rural community? You know, when many of us think about the state of Idaho and, you know, the issue of diversity really doesn't readily come to mind for many of us. But we know that that is, however, not the case. So could you describe for us your community, right? What makes Idaho, and particularly Rexburg, Idaho, such a special place to live?
Well, Madison County was I can't think of the word I'm trying to say. People started moving here in about the late 1800s to develop the community, and it was started up as a farming community with potatoes being the main crop. And the soil here is fabulous for raising potatoes. It has a lot of volcanic ash in it, and it just is perfect for raising potatoes with the climate as well. And farming is a big business here in Madison County with the potatoes. For instance, in the fall, when farmers are getting ready to harvest the crops, school is let out for 2 weeks in October and September to help the farmers get the potatoes cropped, and it's potatoes harvested. It's a huge cultural thing here, and the youth try and get jobs to make money, and in the farming area, in the outlying communities, everybody gets involved. It's sort of a family thing, and it's kind of fun to be involved in it. And there's the farming part of Madison County, and then within the last 10 or 15 years, Rexburg, which is the largest city in Madison County, has also become a booming university town, and which is another whole diverse population from the farming population. And as the college has tried to move into the outlying areas, the planning and zoning have had to fight to protect the farming and the potato industry alive in the communities, so that it isn't overtaken by housing developments. And but so far, the potato industry is still alive and well, and the main people who keep it alive are the Hispanic population. And I don't think we would be able to have a farming industry if it weren't for the Hispanic population in our outlying communities. They will either come and work for a farmer, which is a really good job for them, and they will be given housing, or we have many, they're called bodegas, or potato processing plants, where the potatoes are processed, and the Hispanic people will work in these warehouses. And I honestly don't think that we would be able to have a potato industry if it weren't for these people working in the warehouses, because the people who live around here, I don't think would work there because the work is so hard. And
so, LaRae, as you are talking, we're also showing some of the pictures of your community. We showed a map of the county of Madison County. Yes. And then we've also shown, a map of that's the sign that says "Welcome to Madison County." And then, on the screen right now we have, photo of what we would call, the built-up area of Madison County. So just wanted to point that out to our participants. You talked a little about some of the, the makeup of the community. But how would you describe what have been some of the demographic shifts in Idaho, over the last couple of years? You mentioned, the community as being founded back in, 1865 or so. So could you tell us how does Madison County look today demographically?
Well, there are about 40,000 people in the county. Rexburg, there are about 30,000. And 18 to 20,000 of those are university students or families. So the town of Rexburg is a university town, basically. Okay. And the outlying community is farmers and a lot of trailer parks where the Hispanic people live. We have a lot of trailer park areas where they live. We are 35% of our population are below poverty level, so we are a poor community, and I think a lot of that is because of the university population. We also have Sugar City, which is near us, and they have about 1,500 people in their town.
Okay. So Madison County made up of two, cities or towns, so to speak, Rexburg and Sugar City.
Yes, and the Latino population is between 7 and 9% of the total population.
Okay.
So.
All right. So I know you talked a little bit about the potato farming industry in the community. And many of us are familiar with the Idaho potatoes. We know, they are a staple in many households across this country for lunch and dinner, and in some cases breakfast too, right? So, LaRae, could you describe for us this industry? What does it really take in labor, in manpower, in woman power to get this food item, right, from the farm to our tables all across America? And as you respond to that question, I just want to call the attention of our participants to a potato field in Idaho. These are the plants that produce the potatoes that we get on our tables every single day. So, tell us a little bit about this industry, LaRae, and what does it mean for individuals who are a part of that industry?
Well, I grew up on a potato farm, so I can tell you how it is. But when I grew up, there was not a lot of automation, and they have the machinery and the way they do potato farming has become a lot more modern than it was when I was growing up. But it starts in about May, and the fields are ready for the potatoes to be planted, and they're planted, and then it's I really hated being on the farm because there were so many things that could cause a crop failure if it was too hot, if you got an early frost or a late frost, or a hailstorm could wipe out your entire crop in just a few minutes. And so they're a very delicate plant. And then by about September, the vines will die and the potatoes will ripen, and then the harvest begins. And the farmers put them in their, we call them potato pits, and there's volumes and volumes of potatoes, and they sell them to process plants. Those are the bodegas, and that's where most of our Mexican Hispanic population work. And the people that work in the processing places, it's very, very hard work. They stand at tables all day, sorting potatoes, sorting by size, by quality, by if there's rot, they throw that out. And they stand there all day. They get a 10-minute break in the morning, 10-minute break in the afternoon, and a half-hour lunch. And it's noisy. The noise is deafening. And the men, they will load up the potatoes into 50-pound boxes and get them ready to ship out to market. And it's a huge process. It's hard to explain the volume of potatoes that go through these plants, but a lot of them. Yeah.
Well, we see the results of that, that volume, LaRae, in our supermarkets all across this country, right? You mentioned that, potato farming is physically demanding. And I would also imagine because of the physical demands, that also translates into, psychological demands also, with long days, strenuous work. You also talked about the fact that, weather also plays a role in the success or failure of a potato farm. And so there is that piece around economic burden, because if the harvest is not bountiful, then that translates economically for the population, for the farmers themselves and the people who work on these farms. So I would imagine that, you in the work that you're doing, you see all of that manifested, around behavioral health concerns, behavioral health issues in the populations that you serve, right?
Yes, absolutely.
Okay.
Yes.
And, you talk to us about, the makeup of the population, but you're really focused around the 7 to 9% of the Latino Hispanic population in Madison County. And, I would imagine that what brings most of this population to Madison, to Rexburg, and to Sugar City is the potato farming, right?
Yes, I would say probably 95% of the population are in the potato industry.
Okay, thank you. So, in my presentation, I discussed the importance of respectful, entry and, some issues around authentic engagement with diverse populations as what we call a real imperative for successfully addressing the behavioral health needs of, diverse populations. So, LaRae, can you tell me a little bit about the strategies that you have used to gain the trust and respect of community members with whom you work and provide services?
Yes. First of all, I need to explain that, Karen explained that we have a Systems of Care cooperative agreement, and before I did that, before I worked in that, I was and our Systems of Care grant is a school district. And I think that's kind of unusual because I think we're one of only a few in the nation that are a school district. But we are housed in Madison School District, and they are our fiscal agent. So I'll talk a lot about school in my explanation because that's where we are. But before I worked for Systems of Care, I worked at Madison School District in the Migrant LEP as the director. So I had probably 20 years involvement with the Hispanic community. I know them well. I know the families well, and I think that's probably why I was recruited to work with Systems of Care, because of my relationship with the Hispanic community. So some of the things that we do for the strategies to engage members of the Hispanic community. First of all, we have every school in the district has what we call CAT team meetings, and that's child assistant teams. And each school is required to have one or two of these a month, and that is when all the children in the school, if there are children who are having difficulties, behavioral difficulties, concerns, they're brought up in these CAT team meetings. And at that time, they decide if there are strategies or things within the school, interventions within the school that they can do to help the child, and they try those. And if those aren't working, then they refer them up to Systems of Care, and we take a referral on them, and we contract the families, and we put them on our rolls. And all kids are included in these CAT team meetings, Hispanic as well. So that's a good way we get a strategy we use to involve to get referrals for our Systems of Care program. Another thing we do, which has been very, very successful, and this is an outreach, is we go into the potato warehouses. I have a little team, and I advertise beforehand, and I talk to the owner of the warehouse, and we go in there during their lunch hour, and we really have to be efficient so that we don't take away from their work time. But I take some pizza, I feed them lunch, and we do a brief explanation of our programs, and we talk a little bit about behavioral health, and we hand out flyers, and we give them phone numbers to call. And we have gotten a lot of referrals through that outreach to the parents of the children that we are working with. A lot of the strategies that we use are guided through the need that we see with disparities and disproportionalities. And we noticed that a lot of the kids were not involved in any of the school activities of our Hispanic population. And we determined that the things that they were offering in the schools were not things that they enjoyed, stuff that they could relate to. So we started what we call our Tradiciones, which is a dance team. And we got a teacher who knows folkloric Mexican dances, and we had some costumes donated from the university, and they practice twice a week, and they perform all through the area in churches and different events. And we have gotten a lot of good response through this. A lot of kids who were struggling have said that this is one of the funnest things they do and something that they live for.
And LaRae, could you repeat the name of the dance group again, please?
It's called Tradiciones.
Tradiciones.
Mm-hmm.
Okay,
yeah,
thank you.
That's what they wanted to be called. So
I see. Okay.
And it has been very, very successful, and it's given these kids, these youth, something to do in the after school that's more something that they can own, and it's also spread the culture through the community too.
Okay. So LaRae,
yeah.
you'd say that, one of the ways in which that, one of the strategies that you have used to engage and gain respectful entry to communities is through the Tradiciones, right?
Yes.
That particular program that is culturally based. Some of the other strategies, and I'll let you go ahead. And LaRae, if I could just ask if you could just talk just a little bit more, so I think some of our participants, just a little louder.
Sure.
Thank you. All right.
Yeah, you bet. Another thing we do is, and this is because we are a school district, The LEP director in the school district has quarterly meetings with parents and children, and we, as Systems of Care, we go to those meetings and we do a brief thing at every one of their meetings about some form of behavioral health. We talk about anxiety, we've talked about depression, suicide, just to give them a brief idea of, just to educate them a little bit, and we have gotten a lot of response for the parents through that. Another fun thing we do is we have a non-denominational Thanksgiving dinner, and this is Hispanic people from all churches. And one church has been responsible for doing the turkey and the dressing, and then all the people bring a dish that they have a tradition at Thanksgiving, and that's been a really, really fun thing to get the Hispanic people together and rub shoulders and just talk to each other, and that's been really successful. We have a Parents as Teachers program, which I'm not sure if everyone's familiar with that. It's a 0 to 5 program. It's a home-based program. We go into the homes of the 0 to 5 children, and with our Hispanic families, if we have a Hispanic family that we know as a 0 to 5 child, they're bumped up to the top of the waiting list so that we can decide if there are any particular needs that the family have, and that's been a real good, successful program for us. We have
just another question. How do you address the linguistic needs of these, these children and their families, as you're doing these parent, meetings in schools, as you are going into homes of, with children? How do you address the linguistic needs? If there is a parent or a family that is limited English, do you use translators, interpreters? Are there, services from the community itself that you use?
Yes, well, first of all, we have three bilingual staff members here at Madison Cares. 2 of our parent educators are bilingual, and we have interns through the university that come here, and if we find out they're bilingual, we will usually bring them on. And so we generally don't need interpreters because we usually have bilingual people who can speak for themselves. Plus, we have, through the university, they have 95 different countries represented there of their population. So if we need another language interpreter, we can usually find anything we need. We've been very fortunate that way.
And I think that is so important, because what that means is that you are utilizing the, local resources to meet the needs of, of community members.
Yes. Yeah, and they love to come and use the language that their home language. They love it, so it works out really well.
Mm-hmm. Yeah. And you just mentioned communicating to children and families in the language that is native to them. So how do you talk to families about behavioral health? How do you talk about the issue of depression, particularly in with communities who we find that there is some issue around social exclusion when it comes to the issue of behavioral health? How do you frame that?
How do we phrase it?
Yeah, how do you frame or talk about, how do you bring up the issues around behavioral health?
Well, I've got to be honest, it's not easy. That's a little bit of one of the challenges we've had is a resistance of a lot of the Hispanic families to admit that they have that there are behavioral problems within their family, that there might be a mental health issue. And I don't know that we have a special way of doing it. I don't want to be boastful, but the people do trust me because I've worked with them for so many years. And we just have to be very delicate how we phrase things and approach things, because they're very resistant, and it's not totally culturally acceptable for them to believe that their children have behavioral health problems.
And so, that key word that you mentioned there, LaRae, is building trust with the community members, with the children and their families, so that, to have these types of conversations and, open the door for, again, the acceptability of, participation in these programs. So, LaRae, I just want to turn to another question here, and, if you could tell us a little bit more, what are some of the behavioral health needs that you're seeing in Madison County and with the diverse population that you're serving?
Well, their needs are the same as any other children, only there are more. They have more just because of the situation that they're in here. A lot of them have adjustment disorders, just moving around so often. They're so transient that it's hard for them to always have to adjust to a new situation. They have a lot of anxiety because they're in a new school, a new country, a new language, and sometimes even the lunchroom food doesn't agree with them, and so it makes it very difficult for them, and that they get very anxious. A lot of times we've had this before, as they have left Mexico in particular, they have left under circumstances that their lives are in danger. So they're traumatized when they get here because of the things that they encountered when they were in Mexico. And they hear a lot about deportation. Kids hear a lot about that, and they get concerned about their parents being deported, and they're living in poverty half the time, and there's just a lot of things they have to deal with, these youth in their young lives. So it's very difficult, and we have a lot of our population, a lot of the enrollment we have in our systems of care program are the Hispanic population.
So, LaRae, you talked about, the trauma that many of these children and their families, face, and I want to come back to that, a little bit. But, before I do that, I'm just looking at the screen here where I know that two of our participants asked questions, and the first one is that they wanted to make sure that they understood what we said when I said, about the 5 A's. So I'm going to say, I'll say it again, and I just want everyone to know that, this information about the 5 A's, we'll also post that on the website, and I'll give you the website address at the end. But when we refer to the 5 A's as it relates to cultural linguistic competence, we're talking about access, availability, affordability, appropriateness, and acceptability. And as I said, I promise we will have, resources on that to, post it. And then there was another question from one of our participants, LaRae, is that what are the school communities called? You had talked about, programs within the school, and they didn't quite catch the name of the program that you were talking about. So if you could just say that to us again.
I'm not sure which one they were referring to. Was it the Migrant LEP program? Do you know which one it was?
And there was also another one before that you had talked about. You talked about Migrant LEP.
Okay.
And I think this one, with the children and their families.
Was it the Parents as Teachers program?
Yes, that's what it was.
Okay, that's a program. It's out of St. Louis, Missouri. It's a home-based, it's a home visit program, 0 to 5, and it's based on behavioral health.
Okay, so it's home visitation
with behavioral health as the focus of that. Mm-hmm.
All right, thanks, LaRae. So, again, talking about this issue of trauma and, that, you've identified that many of community members and children experience. Do you think that individuals how reluctant are they to talk about these issues, and how reluctant or how do they access these the services? Is it how do you talk about trauma-informed care in your community, and what does that look like for our diverse populations?
Well, and you're right. They don't want to talk about it. They would just as soon not talk about it, and a lot of times they don't until it gets to the point that it's so bad that it becomes a child can become suicidal because they have kept it inside, and we've had that many times. And we would treat it like, I'm not a clinician, but we always send a Spanish-speaking person in and someone that they know, and we have a crisis plan in place if the child is in danger to themselves, if they're going to hurt themselves. I'm not sure exactly what you're asking me to talk about, Karen.
Yeah, so what I would say, what are some of the cultural issues, LaRae, that really impact behavioral health in a community? What's the connection between the behavioral health services and the cultural implications? You talked about many families coming from the home countries. You talked about the issue of settlement here in your community. What are some of the other cultural issues that impact behavioral health?
Well, that they have to adjust always to a new school and a new language, and sometimes they're just thrown into a classroom and don't understand a word that's being said, and and it makes them very anxious, and it makes school difficult for them. They have to learn a new language. They have to learn the customs of this new country, and they're expected to try and fit in, and a lot of times, because they live in poverty, that causes a lot of anxiety for kids, that they see other kids around them who have so much more than they do, and it's just hard for them. It's discouraging for them, and a lot of times, because they have been brought here and born in Mexico, they almost have no hope for a future. It gets depressing to them to know that they probably can't go to college, and they will probably always be poor, and that ends up being very depressing for them.
Mm-hmm. So LaRae, you talked about some of the behavioral health services that are provided at the school-based level in the community. You talked about, the home visitation. What are some of the other behavioral health services that are available to, diverse populations in your community? And then I want to ask you a little bit about, who are some of those partner organizations? Who are some of those, community-based systems partners that you work with? But first, let's just talk about what are some of those services. What do some of those behavioral health services look like so far?
They're not, bilingually speaking, there are not a lot of services available. We have, outside of the school district, we have one counselor in the whole county who is bilingual, and he is also Hispanic. He does a great job, but he is totally overworked, and so we could certainly use some more counselors that way. We have a clinic. It's called Grand Peaks Medical, and they provide behavioral health services as well, and they do have some bilingual staff there, and they are a clinic for underinsured or not insured people, and they have a sliding scale, so it makes it very possible for people to get help that they need. We have the Migrant Council, which is has a lot of services available for families. And we have a food bank that a lot of our Hispanic families participate in once a month. We give away tons and tons of food. And through District 7 Health, we have the WIC program, and also through Health and Welfare, we have behavioral health program, and they have a bilingual person on staff there. So we don't have a lot, but we're getting better. With our Systems of Care program, that's been one of our focuses, to get more bilingual behavioral health services in the community.
So, and LaRae, you mentioned, obviously bilingual services, but if you had a magic wand, right, and, to decide, what are the services you would be able to come into the community, what would they be? More
counselors, and not just bilingual, but more counselors who are Latino, because I think they relate so much better to their clients. And we need a psychiatrist. We don't even have a psychiatrist here in Madison County. If we want anything, we have to go down to Idaho Falls to get that kind of service. So I would love a psychiatrist here in Rexburg. Yeah.
Okay, so again, we're talking here about the issue, as we know, in so many rural communities, the issue of, workforce, of available, clinicians, practitioners who are going to stay in the community for any length of time,
Yes.
So that's another one of the challenges, is just having a qualified, sustainable workforce, right?
Absolutely, yeah.
Mm-hmm. So, you mentioned the resources, the migrant services, the food bank, the District 7 WIC. Are there any other services?
No, that's besides what we provide with Systems of Care. And, we have a lot of partners, but as far as behavioral health services, no, that's about it. Yeah.
So tell us some about the partners, your partner agencies and organizations.
Okay. The big thing we have is called Madison County Community Coalition. And this is an organization, and it's been here for years and years, and it's made up of all the major stakeholders in the county, like law enforcement, juvenile probation, health and welfare, District 7 Health, medical facilities, education, community leaders, and they meet once a month and they discuss what's going on in the community, the needs of the community, and that has been a good thing as far as getting the word out to different organizations of what goes on in our community. Mm-hmm. We have Madison Memorial Hospital. We put on a huge health fair over the weekend that was really successful. And
just this weekend passed.
Yeah, and we
Excellent.
partner with the hospital on that. The City of Rexburg, the Rexburg Arts Council, we partner with them for our dance group. They provide part of the funding for that. We have law enforcement, the county library, Chamber of Commerce, juvenile probation, District 7 Health, health and welfare. We have many partners, and we all work together for the good of the community.
Mm-hmm. So, LaRae, the other question is, as we talk about how cultural and linguistic competence, integrated into the delivery of your behavioral health services, you talked about, having some of the counselors, that are bilingual. You talked about, offering, language access services. You said that, obviously you would love to have a clinical psychologist, full-time in the community to provide services. But, are there any, cultural, any traditions, any, work that you do with community members, in other words, what we would probably call natural helpers or members of the community that are brought in, to help with the delivery of services?
Meaning professionals or
paraprofessionals or just members of the community themselves?
Well, one thing we really have access to are interns from the university, and they are fabulous. In fact, we have we have a couple of schools who some of the Hispanic kids were having problems adjusting to just socially, having just moved here. And we have an intern from the university who comes down, and we call it Friendship Club, and he's a Hispanic young man, and he goes into the schools and he has lunch with the kids, and he just talks to them about social skills and is kind of their friend, and that has been a really good program, having this Friendship Club. And with the interns, they have been a great resource to us. I lost my train of thought. I had someone else in there.
Other resources that are available.
And in the school district, every school has a paraprofessional that is bilingual, and they provide services as well. They give us referrals. They help the kids as much as they can, and that's been a huge resource to us as well within the school district. I'm not sure what else you're looking for here, Karen.
Okay. So LaRae, and just thinking again about, we talked about the 5 A's of access, accessibility, affordability, appropriateness, availability of behavioral health services in the community. And, you kind of talked a bit about, making sure that there was access and, of course, affordability, through a lot of the services that are provided free. But, how would you address this issue of appropriateness? In other words, ensuring that the behavioral health services are provided in a culturally and linguistically competent fashion, just around even, how the concept of behavioral health is broached in any of the communities. Could you give us a sense of probably some of the challenges that you have as it relates to that?
Sure. Sometimes it's really, for instance, it's hard if we're having a parent meeting or a meeting with a child's parents, we find it very difficult to schedule a time because we don't want them to have to miss work and miss their paycheck. So we adapt to their schedule. Sometimes we'll meet here at 6:30 or 7 in the morning to meet with a parent. We go by their schedule and not what works for us. Mm-hmm. Sometimes we'll go out to the warehouse and have a meeting with the parent on their lunch hour so that we don't take them away from their work. And within our Madison Cares program, we have a social marketer, we have our early childhood, we have our clinicians. They meet regularly, and I attend all those meetings. And in those meetings, we always, as we're talking, we try and brainstorm about different things that would make it more easy access for the Hispanic families, more culturally appropriate. If we're doing an event, we always talk about how we can make it more culturally appropriate for the Hispanic people, and it's always on our mind in everything that we do, how we can integrate cultural competence into what we're doing.
Thanks, LaRae. And, so we're almost coming to the end of this here. Just a couple more questions, for you. What have been some of the most important lessons learned, from working with, the diverse population in your community? Can you share with us one story about your work with, the Latino population in Madison County? What have been some of the lessons that you learned and that provided you with insight as to how to effectively work with this population?
Well, I've learned a lot. I've learned humility. That these people, they trust me to provide the best possible care for their for their children, and it humbles me to know that they trust me with that. And I've learned to love the Hispanic community. And that these families, they want their kids to succeed just as much as any other family. They just have a lot of barriers that prevent this from happening, but they love their kids and they want them to succeed as much as anybody. And I do have one, and it's a quick story, and it's a little humorous, but my husband worked for the power company for years, and one of his jobs is, if he was on call at night, if a customer's power had been shut off for non-payment, he would go out and turn their lights on after hours if they made arrangements to get them turned on. So one night he got called out on a call, and he wanted me to come ride with him. And I said, well, I think I might know where you're going, and I think the family knows me, and I don't want to go and have them be embarrassed. And he said, oh, come on and ride with me. Their power's off. They won't even be home. So I rode with him, and we drove into the trailer park, and sure enough, it was the family I thought it was. And the little girls, they came running over to me, and they said, oh, Mrs. Parker, are you coming to fix the lights? And I said, yeah, we're going to fix your lights. And they said, oh, Mrs. Parker, she fixed everything. And it's just been kind of a cute little story that we always talk about. They always say I fix everything. And just one other little story. It's a little more serious. We've always tried to help families at Christmas, and one year we had an organization that asked us to deliver some Christmas presents to a family, and we were happy to do that. And as I called to tell the family we were coming, the family that we were going to, the daughter had been battling a serious illness for years, and she was in the hospital. And so I called the hospital to see if we could go up there, and we got there, and we had all of our Christmas in packing in there, and it was the most humble experience I've ever been in. This little family they had their little Christmas tree, and they were spending Christmas in the hospital with their daughter. And I almost felt like we were intruding on something, because it was such a special feeling in that room. And we delivered our presents, and it was there's just a special spirit about the Hispanic people, and I've become to love them, and that's why I'm still working, and I should be retired, but I'm still working, because I do have such a belief that we can do good work in that area.
So thanks, LaRae. LaRae, we have a number of participants on our call today who, either live and work in rural communities that have, growing or, fairly significant immigrant populations, right? So what do you say to them about the importance of addressing the behavioral health needs of this diverse population? I mean, what should be the outcomes, right, that we're all looking for?
Well, being that we're in a school district, our outcome is that they learn to behave in school, that any anxiety, any issues that they have, we can help them to alleviate, and our overreaching goal is that they will graduate from high school and hopefully get them onto to a postgraduate education. That would be our long-term goal, but just to get them to be able to function in the classroom and be happy and have good friends.
Well, thank you, LaRae. So I want to turn the webinar over now to participants, and if you have a question for LaRae or myself, please feel free to type the question into the Q&A box.
We can also take questions on the phone. The operator could open the line, please.
Yes, thank you. If you would like to ask a question, please press star 1, and you will be prompted to record your first and last name. Please unmute your phone when recording your name, and to withdraw your question, press star 2. One moment, please.
Okay, so we're also opening the phone lines, those of you who would like to ask a question live as opposed to typing into the chat. We'll just give another second or so for any questions. LaRae, I know you mentioned that you've been doing this work for quite some time, and you're almost at the point of retirement. So I guess one of the questions that I would like to ask you is that how do you pass this work on to, colleagues and to others to continue to do the work once you retire? Again, we know that this whole issue around workforce in a rural community, can be challenging at times. So, what's the succession planning for, this work that you're doing?
That's the hard part. It's hard to think that you can pass it on after you put in so many years. But we do have somebody in the school district who I think is probably being prepared, and she'll take over for me, and the work will continue.
Okay.
I'm hoping so.
Okay. So we have a question from one of our participants that they wrote into the chat is, how do you feel about using translator services via phone when delivering behavioral health services?
I think probably they are better than some of the interpreters we have. Now, I don't know whether she's talking about translating or interpreting, but as far as interpreting...
So the question here specifically deals with translator services, and you're correct, there is a difference between translation and interpretation. They are connected but different. So if you could just focus on the translating of the services here.
Meaning translating the forms and things, or
I think it's just a spoken word.
The spoken word, okay, yeah. I think that sometimes they probably are they're better, the translation services over the phone, as far as being educated to be an interpreter or translator. However, I think that a lot of the personal touch is lost over the telephone, and sometimes it's important to have someone right there doing the interpreting and translating rather than, and you lose a lot in the waiting between the answers and the questions, and if that's all you have, it's good, but I think personal is better.
Right. So, the other part of the question is that the clarification is here, how do you feel about using translator services via the phone when delivering behavioral health services so that an English-speaking therapist can communicate with a Spanish-speaking parent, for example, or the therapist and the parent are in the same room and the translator are on the phone?
I still think it's a little impersonal to have the phone translation services. They've used that at the hospital, and it just is a little bit impersonal. But it sometimes they're more accurate in the things. So I think it can go both ways. Something we absolutely do not do ever, and that's in the school district, is let the child who professes to be bilingual do the interpreting for the parents. That never works out good. So that's something we never do. But Either is good. I prefer a real life person, but if it's not possible, the other is good as well.
Thank you. So we have another question. They say, hello, we are from Puerto Rico Systems of Care, and we are wondering if the speaker had to translate the evaluation tools used with this Hispanic population. So were the evaluation tools that were used, LaRae, how were those translated?
They come translated. We don't. I don't. I will translate forms, like forms that parents have to sign, like when they sign off for a doctor to release the records, those kind of forms. Ones that they're a little simpler, but evaluation forms I don't touch because they're a little too technical, and I think that they have been translated. The evaluation forms have been translated by professionals.
Okay, so there's professional services that you use. And then we have another comment here that says, most of our challenges in providing services to rural youth is actually getting to the youth. Finding a location to provide services in an area that is central and accessible to youth. We have a lot of trouble with transportation. Do you also see that there are some challenges with transportation, in Madison County, getting, children and family to services? LaRae, and are there any suggestions that you have for callers as to how that may, be addressed?
Yes, transportation is always a problem. It has been from the get-go. We have had to be creative. Sometimes our school bus people will allow us to use that. We do have a small public transportation company, but it's expensive. We have asked parents who do have cars to help transport other kids. I don't have an answer for that one. It's always an issue, and we have tried many different things, and we just have to be creative in that area.
And it sounds like some of the services, because they are, at the level of on school-based level. I mean, you did talk about, meeting the parents where they are. So going to, to work, to meet with mom and dad on a lunch break, or going to the home so that the services are going to, the children and families, as opposed to them having to come to a location for the services. It's all about flexibility, right?
Absolutely. Right. We there's no one family that we do the same thing with. We just have to look at each family and their situation and try and work something out.
Right. So we have another comment here from one of our participants that said, it sounds like most of the services provided are more social work geared than behavioral health focused. Is that due to funding limitations?
Well, I might have made it sound like that, but that's certainly not the case. The things I do are social, but we do have clinicians on our systems of care staff, and they do a lot of behavioral health. I'm not a clinician, so that's not my area, but I didn't mean to leave that impression. We do a lot of behavioral health as well.
Okay. So I see another question here. Okay, what has been your experience providing culturally competent behavioral health services to LGBTQ community members, to lesbian, gay, bisexual, transgender, and questioning community members?
That's a hard one too. We are a very conservative community, and that's been an area that I've had a really hard time breaking into, just because it's only been in the last maybe year that the LGBT community have dared venture out and come out and admit, come out in the community. Mm-hmm. And it's that was the area that it is the area that we struggle with the most, probably. There's not a lot of that population here, and if there are, they're not talking about it. So I really don't have any answers on that. I haven't done that well in that area, just because of the community that we're in, and because we're a school district. We've had to be very careful as well, and I've been shut down a lot of times just because of the conservative area that we live in, which is very sad.
So also, LaRae, do you collaborate with the medical community? I know you talked about, partnerships with hospitals, but are there any other, touch points with the medical community around services?
Medical is referring to physical health?
Yeah, well, yes.
As far as cultural competence, or just in general?
Just in general, yeah.
Yes, we have flyers around all the medical offices, and with our health fair, we had we had 85 vendors, and a lot of them were from the medical community. So yes, we try to have a speaker come in here as often as possible from the different offices, and yes, we do collaborate a lot with them.
Okay, thank you. So I understand that we have a caller on the phone that would like to ask a question. So
okay.
Please go ahead.
We have no one in queue.
Oh, there's no one in queue? Okay.
No.
All righty. Okay. And so I think that's for the questions here. So, LaRae, I just want to say thank you so much for spending time with us this afternoon to talk about the work that you are doing in Rexburg, in Madison County, Idaho, for sharing, some of the lessons that you have learned, some of the experiences that you had, and more importantly, thank you for the dedication that you've shown for so many years, to working with diverse children, youth, and families in your community. I say again, thank you for, agreeing to do this, and, for sitting with me on quite a number of telephone calls while we talked about this webinar and prepared for it. And so, in closing, just a few updates I'd like to provide for all our participants is that, again, to say to you all, thank you so much for joining us this afternoon. And we encourage you to join us for additional webinars in the 2017 Rural Behavioral Health Webinar Series. So we have 2 more upcoming webinars that will be a part of the 2017 series. We have Responding to Natural Disasters in Rural Communities. That webinar is scheduled for June 21st, 2017 from 3 to 4:30 p.m. Eastern. And our webinar on August 16th, entitled A Focus on Suicide Prevention in Rural Communities, is scheduled from 3 to 4:30 p.m., again, as I said, on August 16th. For additional information about any of these webinars and also to access archived webinars, past webinars in any of the series of Rural Behavioral Health webinar series, please visit the website that's on the screen currently. And so before I leave, this close out this webinar, I'd like to ask you all just to take a few moments just to complete the feedback form that you will see by just clicking on the link on this screen. We value really the feedback that that you provide us as participants, because that feedback helps us in the planning of future webinars. So what I ask you at the end of the call, if you just take a few minutes by clicking on the webinar on that link and completing that feedback form, will be greatly appreciated. And let me again say good afternoon to you all. Ingrid, are there any final words here?
I just want to thank all of you for participating today, listening. It was really excellent. And I want to